Hello everyone, welcome to part 2 of our online lecture for drugs used to treat infections. Today we're going to be discussing fungal infections and viral infections. I'm Dr. Cosby. Let's go ahead and get started with talking about fungal infections first. Any drug that's going to be used to treat a fungal infection is called an antifungal drug. Interestingly enough, unlike our bacteria, which invade our body and have that hard kind of outside cell wall that becomes pretty unpenetrable by our immune system, making our immune system ineffective at fighting it off. Our fungi are the opposite. They have very similar characteristics to human cells, biochemically and physically. And so for those reasons, our immune system, if healthy, for the most part, is capable of fighting off most fungal infections. Now, there are some things to consider. A lot of the systemic fungal infections that we encounter most often will have been caused by actually taking broad spectrum bactericidal antibiotic drugs. So in other words, we take this broad spectrum bactericidal drug, which destroys all of the good things in our system that are capable of fighting off infection. And so as a result, there's this fungi lying dormant that now is allowed to manifest itself. We call that a supra infection. A super infection is caused by, it's an infection caused from taking another drug. Most often that other drug is an antibiotic, and most often the antibiotic that causes that is a broad spectrum bactericidal drug. So you're taking this drug for 7 to 10 days, destroying everything and anything that would be protective to you. And as a result, you have this fungi living here, which normally the immune system would be able to keep in check, that is now allowed to run rampant. And so you develop a fungal infection. And that's called superinfection, right? It wouldn't have happened if you were not taking that antibiotic drug. Now, we have two kinds of fungi that kind of exist. The first is yeast. Yeast is a derivative of a fungus, okay? But the difference between yeast and most other fungi is yeast are unicellular, and then your fungi are multicellular. So there is a little bit of a different kind of biochemical makeup between the two. But ultimately, we have, just like with bacteria, we have healthy bacteria, good bacteria that's circulating within the gastrointestinal tract. Similarly, we have normal kind of fungal flora circulating in two key areas, orally in our mouth, and then in the vaginal region as well. Your candida is an example of that. We have candida yeast in our mouth and in our vaginal region. Again, that's for extra protection in those two anatomical regions, right? But there are other ways, of course, to kind of develop a fungal infection. We talked about taking antibiotics and how that increases the susceptibility to fungal infections. But then it could just happen as a result of invasion of the pathogen, right? Either through an open wound in specific orifices, right? Through contact with the human, or I'm going to talk about animals as well, which carry a lot of the fungi that jump off of them onto you. It can happen from taking broad spectrum bactericidal antibiotics. We talked about that. And then inhalation. Most often when we get to kind of respiratory drugs, a patient who has asthma will be taking an inhaler. In younger patient populations, they don't know how to use the inhaler, and they tilt the inhaler up towards the roof of the mouth. And so the drug will start to stick, and it will start to layer, and it will cause a fungal infection in the mouth, or a candida infection in the mouth. And so we'll talk about thrush in just a little while as an example of an overproliferation of a fungus in the actual mouth itself. Now, just like bacterial drugs, right? Antibiotics could be bactericidal or bacteriostatic, right? Similarly, antifungal drugs could be fungicidal or fungistatic, right? Fungicidal means they just destroy the fungus, and there is a passive role of the immune system. Fungistatic means they inhibit the synthesis of, thereby allowing the immune system to come along and kind of fight off that fungal infection, right? So as we start to talk about the next types of fungal infection, and believe me, there are many. I'm only talking about the ones that we will see as athletic trainers. All of the ones that we're getting ready to talk through on the next few slides are caused as a result of a specific type of fungi known as the dermatophytes. You know, derm refers to skin. In particular, what they thrive off of are the keratinocytes, or the keratin cells that live on the external structures of our body. They'll attach to the keratin and then start to replicate themselves automatically. So the next group of pathologies, fungal pathologies we're going to talk through, are the Taenia group. Now, in this bottom right hand corner, I've given you kind of just examples of different types of antifungal agents that can either be used over the counter or that can be prescribed. The common ones are in the bottom, your Lamisil or your Tinactin. So I'm using the trade name, that's what we'll know it by. Tinactin, most often used in the treatment of athlete's foot. But you certainly have, if you have a patient, a female who has a yeast infection, for example, she might get some type of Monistat, which is an over-the-counter kind of vaginal suppository. So we can see that antifungal drugs can be oral, obviously, can be topical, or can be inserted vaginally if needed and necessary to treat that particular treatment area. So let's talk through types of antifungal diseases, particularly the Taenia diseases. The first Taenia disease we're going to talk about is Taenia pedis, and that is known as athlete's foot. So athlete's foot, as you can tell, will attack the plantar surface of the foot where we are rich in keratin. And so if we have an open wound, if we're living in a moist, hot, sweaty environment like our shoes, if you have that open wound and that pathogen can start to eat away at the keratin, it will start to replicate itself. The dermatophyte will start to replicate itself, and what we'll see is something that looks like this: a patient who presents to us with the cracking feet, the itchy feet, severe inflammation. If it's wet, there's an increased risk for the development of a bacterial infection as well. But most of the time, over-the-counter antifungal medications will work. So going back to this slide, the Lamisil, the Tinactin, those will work perfectly fine. Rub it on, make it nice and creamy on the bottom of the foot, have them put a sock on. Usually within 7 to 10 days, it will resolve itself. But you always have the repeat patients, right? The ones who have a resolve in their Taenia pedis, but then come back and have Taenia pedis all over again. So what you're going to have to do is find a shoe that allows that foot to breathe, right? And now as we look at the shoe market, the shoes are so breathable these days, right? Patients who suffer from Taenia pedis, we want them to be wearing those breathable shoes as much as is possible. The next form of antifungal disease is Taenia capitis, as the name implies, right? Cap meaning head, right? This is a fungus that attaches to the keratin on the scalp, right? Most often we see this in children, particularly children who are in daycares who have terrible sanitization procedures, a lot of jump houses, right? We see that in children who've been in jump houses playing at a birthday party. Problem is that the fungus will live on the surface. Their head will hit the surface and then it'll attach and start eating away at the keratin. So it's called capitis because it impacts the head. What you'll start to see is the patient will develop some sort of like balding spot because instead of hair growing through the follicles, that fungus has started to eat away at the keratin. And so they'll develop a big, large bald spot over time. So it can happen with contact with surfaces, combs and brushes, which is why it's so important to not allow yourself, your peers, your students, etc. to share combs and brushes, believe it or not, and also in contact with animals. So you know how we like cuddle with our animals, or we might meet someone else's dog and go, oh, so cute, let's hug them. Don't do that. They can actually transfer fungus from you to your scalp, and then you'll develop a Taenia capitis. So as you can see here, what are the signs and symptoms? Big, huge bald spot with maybe red sores, so hair loss, and then severe inflammation. Now, this is an African-American patient, so you're not going to see the inflammation here, and so it might look more gray in nature. And then obviously in your Caucasian or more pale patients, you'll start to see like a redness in that area as well. So most often they're prescribed an oral antifungal. You can put a topical on there, but because of the hair, it just gets really sticky and gooey and actually increases the risk for the development of an infection. So oral antifungals are going to be the best treatment for this particular patient. Next, we have Taenia corporis, or aka ringworm of the skin. So this is where you have a fungal infection that starts to invade the keratin on the actual skin in particular. We see this most often on the face and in areas of folds or creases where it's warm. So right in the fold of the elbow, the posterior aspect or popliteal fossa of the knee. So it occurs as a result of direct contact with humans and animals, or other objects impacted by microorganisms, right? So any of these things can cause what we see here. Again, for ringworm, where we see it most often is in wrestling. Again, it has to do with how well are we sanitizing the mats that the face is actually laying on. So we'll see the transferring of ringworm. It's extremely contagious. In fact, patients are not allowed to participate with it early on. You'll find that you're not even allowed to put tape around it. That's how infection it is. So what are the signs and symptoms? Patient's going to present with something that looks like a ring, and you can see that beautifully kind of here in this patient. It'll look like a ring, and so they'll have severe inflammation in that particular area, lots of itching, very contagious if I didn't say that. Treatment is most often going to be topical, so they'll do some type of topical antifungal medication. One area of concern for patients of color is as you start to put that antifungal medication on their face, you might actually cause some discoloration. So in patients of color, what they typically will do sometimes is an oral antifungal medication to avoid skin discoloration after treatment. Just something to consider when you have patients of color. Next is tinea cruris. As you can see here, it is an inflammation of the jock region, particularly, I guess we could call this like almost femoral triangle region if we wanted to be anatomically correct. Most often caused by like a tight fitting clothes, and by clothes that could be jeans, that could be shorts, that could also be panties or underwears that are just really, really tight in that femoral crease. And then warm environment, wet environment. So we see this a lot. So like think about going swimming and having on like tight trunks, tight bathing suit, and then like you put your clothes on to go somewhere else and you don't change, right? That creates a tight, warm, moist environment and is ripe and ready for a fungal infection. So be careful with that. You see this a lot in swimmers, and then you're gonna see it a lot in football athletes who share jocks. Hate to say it that way, but it actually does happen. So be careful with that. Signs and symptoms are going to be what you see here, kind of a ring in that femoral triangle region, itching, a raised rash, for example. And the treatment is going to be the topical antifungal medication. Next tinea that we see most often is tinea unguium. As you can tell, the fungus attacks the keratin on the toenails. So it starts to create a thickened, discolored toenail, which you can see here. This treatment can be with topical or it can be with oral antifungal. It depends on how many toes are being impacted. The more toes being impacted, typically they'll take an oral antifungal, most often fungicidal approach, so it doesn't spread to each of the toenails. The biggest concern here is as the nail gets raised, you start to see the risk of infection, starts to develop pain. It starts to push into the skin of the nail bed. So there's lots of consequences for these patients. Tinea unguium develops the same way that tinea pedis actually occurs. So warm environments. The other thing that we see in soccer athletes oftentimes, you know how they wear those tight cleats and they start to butt their foot up against the actual cleat itself. So then that nail will get irritated. Put them in a warm, moist environment and they're ripe and ready for the development of tinea unguium as well. So we have to treat that topically and or orally with antifungal medications. The next tinea that we're going to talk about is tinea versicolor, which you can see here. It's versicolor. Its name is honestly truly given by the way that it presents itself. It is a systemic fungal skin infection that causes discoloration of the skin. So you can see these little blotches in darker complex people of color. Those skin blotches will be a little bit darker, so they'll be more gray or a deeper brown. And so it really is like literally the fungi attaching to the skin flora, right? Just attaching and taking its place and replicating itself very quickly. Unfortunately, there really isn't any type of treatment for the most part. It isn't painful. The skin does become discolored. There is some itching associated with it, and they'll have some dry, scaly lesions. But most patients can live with this. They aren't going to die from this particular pathology. Next, probably the more extremes of the types of fungal infections that we'll talk about are the candidiasis diseases. The candidiasis diseases can either be vaginal or oral. If it's vaginal, then essentially what we're referring to is a yeast infection. If it's oral, then what we're referring to is a mouth infection. You can kind of see that here. Again, remember I mentioned incorrect usage of inhalers is usually the number one culprit, which causes oral types of fungal infection. But of course, y'all probably won't deal with this, but as you start to have, if you work with infants who are bottle feeding or nursing, right? If the mom, there's just like this tongue scraper, because the milk will deposit on the back of the tongue. And if we don't scrape the tongue, then you can see the development of the oral candidiasis if you don't have good oral hygiene in your infants. The scary thing about oral candidiasis is that it can absolutely, if it starts to kind of develop and get thicker, it can occlude the airway. And so once again, one of the things that we have to think about is, how do we treat that? If it's vaginal, we can do it orally, specifically if a few things, if there's lots of itching and irritation in the vaginal region, if they have discharge, most often that's going to be oral. But if, the signs and symptoms are relatively low, then they'll just do a vaginal suppository. And why am I talking about this in a pharm class? The reality is we have female athletes who will suffer from these things. And oftentimes when they come to you and tell you, there's just awkward, like, oh, what are you talking about? So let's just put it out there. We're going to be able to help them and coach them through whether or not they need to go get a prescription, or whether or not they just need to go get an over-the-counter vaginal suppository, right, to reduce their signs and symptoms. Signs and symptoms, regardless of where the candidiasis actually occurs, is itching. Either their throat will be really, really itchy, and then obviously discharge, right? That can be vaginally or orally, right? You'll start to see this white putrid discharge. And then also there's going to be a distinct smell either in the vaginal region or the oral region as well. So for oral, it can be topical, believe it or not. So like you can rub something on the tongue, or they can just literally just orally take that. Okay. All right. Now, as we move from our fungal infection group, the next drug that we're going to talk about to treat infection going to be virus infections. So a virus is a small, very small of the three we're talking about, is a small microorganism. Most often it's relatively benign, but it can also lead to severe or fatal depending on its type, right? Severe COVID-19, fatal HIV, which progresses into AIDS, right, which can be life-threatening. And then you can have just the flu, right, that we can fight off in 2 or 3 days. So you can see how there's this massive amount of spectrum. One scary thing with the virus is that they're going to act kind of by interfering with the virus's ability to synthesize DNA. So we haven't talked about DNA in the last two, but today we're actually going to talk about that. So for the flu, we used to just let people live it out, and essentially people were dying from the flu. So there are anti-influenza drugs currently available. They aren't readily prescribed, right? Just because of their side effect. And if I had to guess, probably their low therapeutic index or their increased risk for adverse side effects. So the key thing with flu drugs is they have to be initiated within the 48 hours to be effective. If not, by then, remember that virus is just replicating itself. So you're just going to let the patient live through those signs and symptoms. And eventually what we see is that our immune system is capable of fighting that off, right? So what are the types of viruses that you probably will encounter or may encounter? Smallpox is going to be one of them. Very, very rare now. So many vaccines based on that. Chickenpox, again, if you're working with a youth population, it's possible, but again, very, very rare. Shingles, ironically, I had a 21-year-old on the men's basketball team who actually suffered from shingles. Used to think it was an elderly population virus, but it is starting to plague younger students, and I think stress plays a role in that as well. Hepatitis B is a common one that you can actually be exposed to. So, right, that is a kind of blood to blood contact. So making sure you're using your blood barrier protectionary methods, or your PPEs. That's what I'm going to say. And then the hard part with viruses is the chemical structure is similar to RNA and DNA. So in some cases, the smallpox, the chickenpox, the shingles, the hepatitis B, it makes it very difficult for the immune system to kind of recognize that it's actually foreign, right? It assumes that it's actually good because the chemical structure is so similar to our RNA and our DNA. So they are more challenging to treat, right? So what do we use with viruses? We use an antiviral narrow spectrum drug. We have to identify it, right? We don't want to use a broad spectrum antiviral drug because there are so many adverse side effects associated with it. And so when a virus invades our human body, it brings with it only the necessary DNA and RNA to replicate. So the capsid holding of the DNA RNA invades our body via some sort of airborne mechanism or through an opening through the skin. So bloodborne, right? We're thinking HIV, blood to blood, maybe even fluid to fluid transmission, right? So it invades through that. And then when it enters the body, it finds a host cell, and then it just starts to kind of replicate itself within that cell, so much so that the body can't recognize that it's actually foreign. Isn't that scary? It's like kind of a chameleon. It changes its shape and its color, making it very difficult for the body to actually fight off, right? So if our virus takes over one of those human body cells, then it becomes similar to the DNA and RNA. Again, repetitive here, but it makes it very hard for our body to recognize that as foreign. And so what it does is it just takes over. And by the time the body recognizes that we have a foreign virus in our body, it becomes very difficult to treat. Now we're talking about the extreme forms of those viruses. So, right, like HIV, smallpox, shingles, all of those. We're not talking about the traditional influenza, right? So, with antiviral medications in particular, they have the medium to low therapeutic index. For the most part, they're generally well tolerated, but they have high risk for causing diarrhea, nausea, and obviously vomiting, right? So one thing that I want to talk about, and sometimes we don't talk about it enough here, but I think it's important as you all move away from white loma, to this concept that the reality is that kids are becoming more sexually active earlier on in their lifespan. So this is an encouragement of that, but how do we help student athletes who present to us with sexually transmitted diseases? The first thing that I want to do is kind of have you look at the number of sexually transmitted diseases in 2014 and then 2019. So you can at least just wrap your head around the fact that this is almost in and of itself kind of a pandemic, right? So in 2014, about 1.9 million new reported cases. And then we moved to all 5 years later, and we're at 2.6 million. This is the most recent data. We can imagine that there's still kind of this upward trend, right? So if we add 4 more years to that, we're probably at about 3 million new cases being reported each year in 2023, right? So we have to be equipped to coach our athletes through how to live with sexually transmitted diseases, right? Okay, so let's talk risk factors. The biggest risk factors for patients to develop sexually transmitted diseases is the number of sexual partners, right? The next thing is, particularly with males, same-sex partners are at a higher risk for developing sexually transmitted diseases, particularly if it's male-to-male contact, right? So what am I saying here with this slide? I want to say this to you all, that while we don't necessarily treat sexually transmitted diseases, we have to be able to educate our patients on what the risks are and how catastrophic the development of a sexually transmitted disease can be. And then we also have to be comfortable enough to have that clinical conversation with the patient who might confide in us that they actually do have a sexually transmitted disease, and understand what are the side effects. Let's go back to this side. What are the side effects that they might present with if they're actually taking an antiviral drug, and how do we help them through a season? Maybe being dehydrated because they have diarrhea, maybe being dehydrated because they have nauseousness or vomiting, right? So those are all things that as clinicians, we have to be able to have that conversation, right? So as we think through both antiviral and antifungal medications, understanding number one, the routes of administration that can be oral, can be topical. Most often they're not injected, but those are the two main forms, oral and or topical, right? So oral, topical, And intravenous is another one. Particular, it just depends on the extremes of the signs and symptoms of the patient. And then you can do inhaled as well. So what are some guidelines for athletic trainers? That's what I want to talk about. I think that's most important, is like, what are some of the guidelines that we should be considering in patients who kind of are taking these drugs, right? That's where we need to be ending this lecture. So our big job is an identification, right? We have to identify, do we need to refer them out to get treatment, or is it something that they can fight off naturally, right? Most viruses, minus the ones that were listed, right, a patient can fight off. But the question just becomes, and fungal infections for that matter. But at what point in time when a patient has a bacterial, fungal, or viral infection do we actually need to refer out, right? That's the key, specifically for like, let's say the influenza, where we know that within the first 24 to 48 hours, it's crucial if we actually do want them to take an oral medication, right? So those things become extremely important. The other thing that we have to think about is the development of drug resistance, right? And we talk through that in the antibiotic component, that they must finish taking all of the antibiotic medication. If they don't, then we typically see that they become resistant to that particular drug group. And if I didn't say it, I'm saying it now. So we know that with antibiotics, at some point in time, we start feeling better. And usually we start feeling better before we're done with the prescription. And the temptation always is to stop taking the drug as soon as we feel better, right? But with antibiotics in particular, one of the things that becomes extremely important is to make sure that the patient finishes taking that drug. Because if they don't, they increase the risk to develop resistance to that drug if they were to ever take it again. So this becomes extremely important in patient education. The other thing to keep in mind, particular as we think about the sulfa drugs, which really cause heightened adverse side effects, is to ask a patient if they actually have a drug allergy. Most common, penicillin and sulfa drugs are the two most common types of drugs that patients typically will have some sort of allergy to. So knowing whether or not they have a drug allergy, knowing whether or not they had a poor reaction, you're not going to be able to do much with that, but to share it with the physician, right? So that they don't prescribe your patient a drug that they've had a reaction to. And then the big thing for you, identify and then making sure they're compliant. So once they have the prescription, knowing how long they're supposed to be taking it for, and then you're the one that's going to see them every day. Their physician, their nurse practitioner, their I don't know, PA, they're not going to see them every day, but you are. So your role is to make sure that they're compliant with taking that prescription drug, particularly those antibiotic medications. So I hope this has been helpful for your exam, for your board certification examination. You need to know all of the tinea fungal infections, which is why I spent so much time there. As it relates to fungal and viral infections, just understanding there's a short window of time that we have before the patient, before the drug they're getting ready to take will no longer be effective. And then becoming familiar with some of the over-the-counter drugs that are available to your student athletes to treat most of the tinnitus, right? And then also recognizing will be an extremely important component and role in athletic trainers, particularly as it relates to infections caused by microorganisms. I hope these two lectures have been pretty helpful in helping you understand the process by which the fungal and the viral and bacterial infections can actually occur, and how we work together with other healthcare clinicians to treat those over time.